If you prescribe 400 milligrams of lacosamide daily to 10 patients that are on at least one other anti-epileptic drug, you can expect 4 of them to have a 50% reduction in their seizure frequency, meaning if a patient had 10 seizures a month, she now has 5 or fewer. It is not seizure freedom, but many consider it a meaningful change, and it can be very rewarding to hear 4 patients doing significantly better. The problem is that these numbers are a bit misleading. 2 of the 4 patients would have had a 50% reduction without the 400 milligrams of daily lacosamide, and you can't distinguish which ones the drug is actually helping. What's more, at least 2 of the 10 patients will have side effects that are so bothersome that they will stop taking lacosamide altogether. It should be noted that 1 of the 2 would have developed the side effects without taking lacosamide. But again, you cannot tell which patient that is. So in reality, lacosamide is only making a meaningful difference in 2 out of 10 patients' lives and causing a considerable amount of distress in 1 out of 10 patients. 8 of the 10 patients are essentially receiving no meaningful benefit from lacosamide. We know this from 3 well-conducted randomized clinical trials of hundreds of patients. The reason for the discrepancy in your experience stems from the 20% in the trials that improved while on placebo. 20% sounds surprising, but there are many reasons to explain why seizures decrease while on placebo. For example, we know that some people's seizure burden ebbs and flows or goes down naturally over time. That said, you do not experience only 2 patients receiving benefit when prescribing lacosamide. On average, you experience 4 out of 10. When 40% of your patients are coming in with stories of success, it is hard not to get excited. Additionally, in practice, you might try another drug for the other 6 patients that did not have a meaningful change. Then all your patients on lacosamide will be the ones that initially responded. But in reality, 50% of your patients on lacosamide are receiving no benefit from the drug, with all the risks of side effects, but you cannot tell which ones they are. Also, the 4 out of 10 that originally showed improvement is an average over hundreds of patients in 3 separate trials. You could randomly get 6 or 7 patients to show improvement, while another doctor might only get 1 or 2 patients to improve. Taken together, the average would be 4, but you would have very different feelings and opinions about lacosamide based on your personal experience. You live for positive moments in medicine, and you want to think you had some part in bringing them about. It is easy to see how you could fool yourself into thinking lacosamide is more or less effective than it is, and developing unrealistic expectations and poor prescribing habits. There is nothing especially tricky about prescribing lacosamide in particular, and it appears to be a fairly decent second-line medication. It has a number needed to treat of 5 over 12 weeks, which is actually relatively impressive in medicine. For example, the number needed to treat to prevent a non-fatal heart attack in patients with known heart disease with a statin is 39 over 5 years. The tension and difference between clinical experience of a drug and trial data about that drug is the difficult reality of prescribing medications. In practice, you should never rely solely on trial data, as many, perhaps most of your patients would not have met the inclusion criteria for the study. So it is hard to say whether the results apply to your particular patient. Yet, that data should anchor your expectations, as we are fantastically capable of fooling ourselves, and providing quality care requires that we are constantly reminding ourselves of that fact.